Okay.
We are recording, so don't say anything bad.
So where's Trish? We do have to wait for her, right?
I think she's in now.
Okay. I don't see, there she is. Trish, how you doing?
Good, how are you, Vinny?
I'm hanging in there. Okay, you're on, but do I do like Kelly? I read them off, or are you gonna do them? How do you want to do it?
Well, we have to call the order of the meeting first.
Oh, did I miss something?
No, no. It's 7:01. You're ready to take over. Go for it.
Yeah, okay. All right. Being 7:01 on January 12th, I'd like to open up the Board of Health meeting. Myself, Trisha LeClaire, Chair, Kelly McGovern, Vice Chair, Vinnie Forty, Member, Bruce Wilson, our Health Agent, Tina Griffin, our Minutes Clerk, and is Robbie on?
Yep.
All right, and Robbie, our Food/Tobacco Agent. So first thing to do is approve our minutes from December 1st.
Long time ago, 5 weeks.
Yeah.
I've already reviewed them, so
Okay. I was talking. I should have been reviewing. I know. Whatever. Okay, I'd like to make a motion to approve the minutes as written.
a second.
All right, all those in favor say aye.
Aye.
Opposed, motion carries. I just want to go back for one moment. I just noticed that Esther Martone, our public health nurse, is also here.
Okay.
All right, so the next thing is coronavirus updates and vaccine plan.
Yep.
Oh, wait.
Everybody, I'm going to share my screen here to pull up a couple drawings here.
Okay.
All right, can everybody see the school okay?
Yep.
Okay, so what I've got is I've got the vaccine program. We decided to make use of both schools here so that we can have a general meeting place and queue up as many vehicles as we can without causing traffic problems out on 126 around Blackstone Street. So that we're going to be entering the school property on the 126 side there. We'll put a signboard out here, entrance with a police officer. You come in and you're going to stop at the registration table. It's our intent to try to have this set up so that you've gone online or called in to our site there and set up an appointment. So if you show up and you don't have an appointment, I've got a line set up so that you're in and out, and then you go back and set up your appointment and come in so that we don't have any issues. There's a form that you'll be filling out. It'll be provided either at the town hall or you can get it online. Then I've got 2 lanes coming through here. You come around, you're going to see an attendant, get your paperwork squared away. He'll pop a temperature and put you in either one of the 2 lines here. The line to the right would be 1 to 2 occupants in the car. The line to the left would be if you have a car full, with more than 2. The attendant on the exit side here will have a 2-way radio and be in contact with the high school lot that's there. The officer will let you out. So then you will pull up the street and come in to the entrance by the football field. There'll be an attendant there. You come in, you come around, and you come up to the top. And there'll be an attendant here where he can either send cars to the left or to the right. The intent is sending you to the right would be the smaller car, 1 to 2, so to go through quickly. And then you would come over after you shot and sit in the parking lot, the wait area where you wait 15 to 20 minutes to be sure that you don't have a reaction.
Excuse me, Bruce.
Sure.
Sorry, I didn't mean to cut you off. I didn't want to have you to have to repeat this. I got a text from a couple folks that are waiting in the waiting room, trying to get in. They were interested in this topic is all.
Oh, okay.
When I share the screen, I lose track of the participants. Okay, welcome everybody. I just want to, Jim, how do I mute these people?
You can just yell at them, but you can also just on the right side, there's a dot.
Okay, Jim, unmute yourself.
I think you just did that. You just muted everyone.
Yeah, I did. I muted everybody. That way we don't have people jumping in the middle here. For everybody that's coming here, I'll go back to the first plan that's coming in. This is a draft copy of a plan to utilize the 2 school properties in our process here. This is nothing to do with who's getting their vaccine, when. That information will be provided as soon as it's provided to us, and it will do a code red call or post something on our webpage, or you can call in and check, and possibly we'll notify the news channel so that it's available. But at this point, we are still waiting on information from the CDC as to when we're going to have the vaccines and which phase and step of people will be there. So I know a number of you people are interested, but we are addressing those comments tonight. Just the stuff here that has to do with the school, and if my board has any input as to recommendations. All right, to go back to it, we're utilizing the 2 schools. We'll be coming in off of 126, entering onto the property to be a signboard, an officer. You'll come up to a table here at the registration. If you have your appointment, you'll continue on in the red here. If you have no appointment, you show up and you pulled in thinking that you could just jump in the line, we're going to send you out, and you'll have to go back and set up an appointment and come in so that the proper paperwork and everything is in place, and that we don't have too many people show up. You come over here, you'll see an attendant. He'll take your paperwork, he'll pop a temperature, and he'll put you into one of 2 lines here. We have a line with 1 to 2 occupants and a line with more than 2 occupants, so that we can keep track of sending over the vehicles as needed up to the high school. There'll be an attendant with a 2-way radio and an officer here directing people leaving the lot up to the high school. I'm going to go to the next page. It's here. When you come down the street here, we'll enter in by the football field. There'll be an attendant here directing you up and around and up to an attendant here that's going to direct you either to the right or to the left based on the number of occupants and whether or not we've got a bottleneck somewhere. Maybe somebody had a reaction or something like that and it slowed the process down. But this attendant here will try to keep things in a smooth flow. There'll be people giving shots in 2 different locations. This is the car with less occupants because we have a smaller parking area for wait times. You get your shot, you proceed up to the wait area. It's a 15 to 20 minute wait to be sure that you don't have any difficulty with the shot and require some emergency care. There'll be an EMT on each of the lots that's here. If you were to come this way, you have more occupants. You'll come around and you'll be in this wait area here as well. We'll be handed a piece of paper when you check in with directions on if you have a reaction to beep your horn, flash your lights so that we can get you your EMT care over there to the vehicle as quickly as possible and deal with any reactions you're having. Once you're done, we'll be exiting out each of the parking lots and coming out the main entrance. The main entrance down here will be blocked with cones. That will be strictly for emergency vehicles only, and only exiting here with an officer here that will direct you out onto the traffic safely. It's pretty simple plan here. Hopefully we can get 500-600 people a day vaccinated, maybe more if it goes smoothly. again, you know, we'll be setting up a call line at the town hall to get your appointment, or you can go online and get the form and get it in. We want to make sure that we don't have too many people show up all at once. We try to time it so that we have 15-minute increments with a number of people coming through here so that everything is streamlined. I don't know if the board has any thoughts or inputs on the plans. There's more detail to come because we'll be providing some tents and running water bathrooms for some of the staff. I've got some porta johns located out in the parking lots. You know, some people will have been there quite a while, and if they got little ones, sometimes they're going to need to use the facility there. But I don't know. I mean, if the board's got some thoughts on that, or I've reviewed this with
Bruce, one thing, when people are waiting in this zone here, the less than 2 or the greater than 2 occupants, how many will be there? And if you only have 1 EMT, and let's say you just happen to be, it's unlucky that day, you got 5 or 6 cars in there and you got 5 or 6 people with you.
There's gonna be 2 EMTs,
Okay,
2 ambulances on site.
okay,
So if you run into trouble, the other can jump
Okay.
in. Esther will be there with a gator so that she can go back and forth. And again, everybody's gonna have 2-way radio. So I mean,
okay. At that point, the EMT or ESTA makes a determination whether somebody gets transported, I guess, at that point.
correct.
Okay, got it.
I mean, and feel free to jump in, Esther, if you have anything to say on that.
No, the only thing that I would say is, you know, you had mentioned multiple people in the vehicles. Every person in the vehicle has to have an appointment. Don't think that you can just bring your whole family and you'll all be
Oh, no.
vaccinated at the same time. You know, I just foresee people saying, okay, let's get a car load and go get vaccinated. Everyone in the vehicle needs to have an appointment.
And I guess with the appointments, we're gonna try to stagger, like you said.
Correct. It's going to be an online system that's going to be utilized. So it will only book so many people for a certain time period. So we will not be inundated with, you know,
Okay,
hundreds
good.
of people at once. Yeah.
So whether you do it online or whether you call in to get a form, or is it gonna be only online registration?
I was gonna set up a call line, take advantage of some of the senior help that we have.
Right,
Separate line other than the Board of Health, so we don't interfere with the general business. And they can take the thing and enter it in. You know, maybe we'll set them up with a laptop or a computer, but
okay,
get the forms into the system. Some people don't have computer access, but you know, we're gonna try to make this as easy as possible for people.
okay. And then
Oh, go
You'll
ahead.
you'll get 500, let's say, for that day, and that should work. Day 1 will be the test.
Yeah,
And
Dave,
then
we might be
you'll
able to get more.
You'll keep booking accordingly. Okay,
Correct.
either less or more based on the first day's operation.
Correct.
Okay,
I have a feeling that once we get the shots for our over 75 group, that'll be a good test run. There's about 1,000 residents over 75. So, I mean, that could be a good test run for us.
so you're gonna try to do 2 days of that, or you're gonna try to make it 3?
We'll do, my goal is 2, if we can do.
2, okay. So at that point, yeah, that'll work. I guess that'll work, because that's, if you're gonna go 8 or 10-hour day on this. Well, if you go 10, that's 50 an hour. Esther, isn't that a lot? I don't know. How many nurses?
Yeah, exactly. I mean, it's going to depend on exactly how many nurses and EMTs or, excuse me, paramedics we have
Correct.
available to vaccinate, and that will dictate how many per hour we can handle. You know, I think we had talked about also making sure that we're doing it in shifts so that we don't have people burning out.
Reading out.
You know,
correct. Yeah, you need a break.
Right, exactly. So, I mean, all of that is being taken into consideration in the plans.
Okay, good. Okay,
Oh, looks good.
yep.
I'm gonna pull the regular screen up. There we go, everybody.
This will probably be, I have to say, this is gonna be more intense than our
Flu-
SARS vaccination of 4,000 people in over a week or 2. This is definitely gonna be more intense, so,
Oh, for sure.
you know, I'm assuming most of the 16,000 people will get their shots, you know. Now, again, I don't know how many are children, how many will go to their pediatrician,
Well, children aren't even taken into consideration, Vinny. None of the vaccines have been approved for those under
Okay.
16.
Oh,
So
okay,
that's,
okay.
yeah, that's not even in the count at this time.
Okay, what I'm not sure is out of the 16,000 population, how many are under 16? I don't know. Anybody want to venture a guess? I have no
Vinny, is,
idea.
the Gillette Stadium will be open. They're talking about 5,000 people a day. Or
Yeah.
clinics, or you might even get them from your physician. So, a lot of it's going to depend on availability,
Right. Well, we'll see. I mean, I still think we'll do more than 4,000. Yeah, whatever. Which would be basically 8 days. So, if it works, the 500 works. Okay. It's good, Bruce. Looks good.
Also, I've been, we're on the coronavirus update. I've been looking at our numbers. They seem to be staying pretty good. What do you think, Esther? I mean, we get some.
I don't want to jinx it.
I know.
It's a revolving door. I think over the weekend we had like 20 some odd new cases, but by the same token, we had a bunch of recovered. So it seems as though we've had roughly 80 to 86 confirmed active cases over the past couple of weeks, and roughly around 25 to 35 probable cases active. So it's revolving, but they do seem to be plateaued, so to speak. I don't
Yeah.
want to say that we've peaked, because I'm waiting to see what happens from New Year's, but knock on wood, so far so good.
Well, you
Yeah, we're
don't think,
almost out of that window though, just a few more days and
Well, for New Year's Eve, yeah, just a few
Yeah.
more days. Yep.
yeah. Okay, I have a question, Esther. I think you said you have to wait a couple of days, but just looking at the numbers right now, I'm going to say the peak from New Year's is probably here anyway. Is it bigger or smaller than, how do we say it, Christmas time? Because, or even Thanksgiving, if you want to break that up, because that period of time, the state went, I don't know, from a few towns to almost 3/4 of towns being in the red. Rates of, the last few days of 7,000 dropping now to 4 and 5. We're feeling good, even though that's a lot of people, being, let's say, sick with the virus, confirmed. So,
Vinny,
I don't know. Is it bigger or smaller right now from New Year's?
You mean from Thanksgiving? I would say Thanksgiving was probably more than Christmas.
Okay. Okay.
You know what I mean? But I haven't seen, knock on wood, a lot of gatherings for New Year's Eve. So
Okay.
I would say that Thanksgiving was probably the biggest holiday where we had the biggest impact. I will tell you, after speaking with a lot of families, there are entire families that probably have the virus and only one person is being tested. We can't force people to go get tested. So
No.
those numbers are not being taken into consideration, but there are many families who are just opting to go with the 10-day, quarantine guidelines,
Okay.
and not be tested.
So if they're a contact, they just quarantine for 10 days and they don't have to get tested. Okay, that's good, I guess. I guess the only other thing was, maybe after Thanksgiving and getting up to Christmas, the governor and every health person was saying, you need to stay home, both nationally and locally. And hopefully that led to people being more responsible, I don't know. I'm hoping, because I figured, like, if people see the effect and then they say, well, geez, I don't want to be one of those people, because, you can, it's Russian roulette. You can die. It's not like,
no
a headache.
cases are the same. Anything else on the coronavirus update?
Well, I guess something you brought up, Trish, and I'll throw it out there because I was curious. I guess some of the people, on the news or in gatherings have been saying that, people who've gotten a flu vaccine are getting a little more than just like, let's say 12 to 20%, a little bit more than like a headache. Some people getting a fever, chills, diarrhea, and I don't know about throwing up and other stuff. I'm going like, well, it sounds like a little bit more than just like a, a mild effect.
Yeah, but everybody's different. So someone could just have a little tickle in their throat and
Okay. But has it been much more than after the flu vaccines in terms of reaction to this mRNA vaccine, which is not a virus killed, it's actually the genetics of the DNA of the virus to enact your immune system to produce a more robust immune system through messenger RNA. So I'm just curious. It's more innovative, more scientific, and a way different approach than using flu vaccines, which either are live or killed viruses. They're not part of the DNA of the virus,
so you're asking if like we've seen
I'm
a lot.
wondering if now like I said, this is, gonna cause less people to get it because they're saying, I ain't going through this baloney, I don't know. I mean, there was a little bit on the internet, you could see it. And I was reading some and I'm going like, geez,
I would recommend no Google anything.
Okay.
Yeah, I mean, I've had some people say that they've had a sore arm. I've had some people say that they have had absolutely no reaction to the vaccine whatsoever.
Right.
And quite honestly, a majority of the people have just said, yeah, my arm was a little sore and that's it.
Okay,
Correct.
good.
So
Right.
I haven't seen any other reactions.
Okay.
Some people
Okay.
complain in fatigue, but
Yeah, that's
Yeah, and I'm hearing the fatigue more so after the second shot
okay.
and
And
the
it's
sore
what-
arm.
it's like
Sorry.
12 to 24 hours of being
Right.
tired, and then you bounce back.
Correct. Yep.
Okay. In other words, I don't like the fact fever or other things that affect your body's digestive system, because that means you're not going to be staying in your house. That's my idea is, I get the vaccine, I have a sore arm, fine. I still can go outside and work and have fun, not like, geez, now I'm in the house,
Well, even if you were in the house, you're only going to be in the house for like 24 hours and not, 10 days or 14 days because you feel like absolute garbage.
Okay. Yeah, that's right. I guess people with it can say, yes, it's worse than the vaccine, right? Okay.
Correct.
Okay. Thank you.
Anything else on coronavirus updates? No? Okay.
I don't have anything else. Nope.
Okay. So then let's move on to tobacco food agent. That would be Robbie.
Actually, you wanted to, it's, Robbie and Esther are both up for their annual review. That's what's next on the.
Oh, is it?
Yeah.
Oh, okay.
Oh.
That's right.
Oh,
The annual review should have been on the front line with it. I got it.
okay. And we didn't have the paperwork on that, so
I thought the annual review was the annual report. It isn't. That line should be up where it says tobacco and food agent.
well,
Okay.
I did want to talk about Esther anyway and her
Okay.
annual review. So that was for sure. I didn't realize Robbie's was up too, so I'm sorry about that.
Mhm.
But obviously, with everything that's going on, Esther has been just doing a phenomenal job keeping up with all this. When she signed on with us, I'm sure she wasn't expecting this because we weren't expecting this. And I feel like she's done, a great job with communicating with the community and us. She really hasn't skipped a beat through this whole process. And with that being said, I think that, we should consider a raise for Esther.
I agree.
Is Kelly on here?
No, I thought we already discussed that the last time around. No, we were
I-
looking for her contract to update the contract.
We were, but no, seemed to
It's not
find.
here, but I know. That's why it's on tonight's agenda, because we talked about the last time and they were supposed to have the things here, but it's not.
Is the annual review also her contract period too?
Well, it's yearly
Yeah,
and
so I'm saying,
overlooked, so
think what
technically-
Kelly's saying, and we talked about this earlier, but it wasn't at the time that we wanted to do it, but now it is this, it's her
We don't
annual
know because we
review.
don't see the contract, so I don't know when her
Oh.
renewal, I think it's January, but I don't
Yeah.
know.
Did
Right
we-
here.
We
So,
don't have a
from
contract.
talking to Esther, her original, and correct me if I'm wrong, Esther, her original sign-on with us was August of 2019,
Oh, okay.
or maybe it was,
That's correct. The end of August of 2019.
yeah.
Okay, so we should have did it in August or September, but okay, whatever.
We were kind of busy with the COVID stuff.
I know.
Just a little bit busy.
I
with
think time flies when you're having fun, that's for sure, because I
Yeah,
thought
yeah.
it had been forget, so.
Well, probably, I don't know, maybe not during that period, but certainly in June, July, we were meeting every single day with it. And then it probably in September went to every Tuesday. I don't recall. Maybe Dennis, you could add light to that when we switched to, let's say weekly instead of almost every day, but I think it was probably after June.
Either way, I think there was a contract of some sort, because I know we had town council review it.
Correct. yeah.
Whether she signed it, I don't know, but we should probably have one signed and then updated to reflect the raise. So
Yes, yeah, I
I
agree.
think we asked for that the last time. So Bruce, if we can get that ASAP so we can make it effective immediately.
Yeah,
Okay,
and then we can just come in and sign it off.
So,
There is no paperwork or contract, so
There was definitely one that was sent to town council because we just revised the old health agents. I'm sorry, public
Yeah,
nurses
We
contract.
definitely did, yeah. It
We
was,
definitely did.
yes.
does anybody have a copy of
Town council should.
it?
They're the one that drafted it.
Yeah,
reached
if
out.
not, I might be able to go look and see if I have it, but I don't know. I have to go dig in my file cabinet.
Okay, please do.
but so when I asked Laura, when I sent that email, I don't know if you guys saw it, and asking about it, Laura said that we don't have to have a contract. And Dennis, correct me if I'm wrong, or if she's wrong, whatever. But she said that we don't need to have a contract for them because they're town employees.
Oh,
But-
that's true.
But
yeah.
I think we had the job description and everything in there. That's what town council had added to that for us. But I could be,
Okay, if that's the case, when you do an annual review of an employee, regardless of their hire date, if you want to make it, it happens to be January now. If the annual review is every January, that's where you can up the salary or leave it alone. So at this point here, I think, or up the hourly rate, I think let's, I don't know, get a consensus tonight or get a copy of some, what we call an employee review like we did for Bruce, and then simply you can just tag something to it. Met the bullets and the responsibilities of the job, and then simply say exceeded it, and then, add.
are you guys gonna have time to do those? Vinny, it
Yeah.
took a while, remember?
Yeah, I know. I still got Bruce's. I don't know what we're doing with Bruce's.
I still
Bruce, how
haven't-
you doing? Yeah,
Bruce is done.
yeah, okay. But what I'm saying is, you just do the same thing for Esther and just,
Esther and Robbie, do them both at the same time.
yeah,
Right.
yeah.
Okay.
I mean, without taking, put it this way here, we can get the performance appraisal done, but we could actually just simply modify the hourly rate at this point, and then just add that to it and say that future reviews will be every January. We'll just go calendar year instead of employment year or month. So it's probably easier too.
So how does that work with other town employees that are hired? Do they get?
I think the union meets and gives them a percentage raise.
We didn't do that with the last health agent. We had a contract.
We did, yeah.
No, I'm saying even for this circumstance, because Laura said that we need to have a contract. But like, do other town employees have contracts that they have to renew every year or
Yeah,
no?
Trish, Trish, typically you'd have a contract. I'll bet if you check your minutes, you'll find that there's something there when you hired her. I'm sure you had an agreement, particularly if you send it off to town
Mhm.
council. Most of our employees that are contracted, we have something with them. Of course, the health agent would be in the professional administrators
Right.
association, so be included there. But for most of the hourly employees or employees that aren't in unions, usually they're part-timers, less than 20 hours, or and we have some sort of employment agreement with them. So I'd be surprised if there isn't something from a year ago, it's been about a year and a half that Esther's been here. Esther's been here through Triple E and pandemic, much like Bruce. So they've had all the fun.
So we agree that there's something because we remember drafting it up, but no one can find like really.
Yeah. Typically Beth would have those in the, in human resources, but we can definitely check on that tomorrow, see what we can find.
Okay, thank you for that.
Yeah, because if Laura can't find it, you're right, Beth would have it, and then if she doesn't have it, I'll go look, but I don't know. I
Well, I
might
think
have
the
it.
problem lies in that Esther doesn't remember signing one. So if she doesn't remember signing one, then there probably isn't one there, but we definitely have one drafted because I remember them doing it.
Right, right.
Beth,
So
Beth
it
just,
wasn't followed through.
Beth
Beth-
just sent a message saying that she's looked and she has nothing.
Really? Okay.
Bruce, you gotta call town council because I know that they
Yeah.
did do one.
I'll
Hopefully
check
it's
in.
the current town council that.
Yeah, I don't know. I mean, all they know, we had such a problem with Trish, that, not you, Trish, the other Trish with the SH, our other nurse that, I'm sure we did a contract. Is,
Oh, we definitely, no doubt.
and then we set a rate, an hourly rate, and I thought that would have been filed. At that time, I can't remember now, when Esther, when you were first hired, was it actually, it was as a contractor and not as a, what we call a special town employee type contract? So maybe that's why there's not one. I don't know. I can't remember. But even for Trish Parent, we had a contract with her and a rate attached to it. So like I said, I may have that one, and we modified it a little bit.
Well, if we don't have one, now's the time to do one and we'll just rectify it and go
Right.
forward the correct way. It's okay. So we'll do
Okay.
both Esther and Robbie at the same time, their reviews.
Okay.
So are we going to use the same format as we had for the health agent, or is there a simpler one out there?
I think we need a simpler one. I think
Yeah,
that
yeah.
that one is too much of filling in stuff
Maybe
that,
Beth has something. I see she's been chatting here on, maybe Beth
Yeah.
has some simple review form or something that maybe.
I
we
don't
can
think
share.
right in their job description, because if we have the contract, we can just attach the job description to it with a signature. Do you know what I
Right.
mean? Make that part of their review. And then we can always adjust it as needed.
Beth,
Beth,
send it for some
for
examples.
example.
Sounds good.
All right.
Okay.
Thank you,
So
Beth. Beth is going to
so
look for examples.
we're gonna review this again then, the plan?
Yeah.
Or are we gonna move forward with the conversation right now? We're gonna wait?
Well, we're going to do the review and check out do the contract, look at the former contracts and revise accordingly. I think that's the best course of action. And then we'll revisit it for the next meeting, which is
Okay. So it'll still be in January, and then, okay, fine.
February 2nd.
Yeah, February 2nd is our next meeting.
Every second. Okay, that's fine.
And that gives us plenty of time to figure this out.
Okay, I guess. So we're doing Robbie's too, or are we waiting until we have that in place too?
We'll do both.
Okay,
Yeah, we'll do it at the same time.
okay.
All right, so next thing on the agenda is the annual report for 2020.
I got revisions from Laura on putting in the correct amount of corona positives. So I'll add that to the agenda.
Wow.
I'm sorry, the report. And then I also have the updated numbers for the septic betterment on how many we did and how many systems done and all that. There was one spelling error on the last sentence, but other than that, I mean, the whole year was COVID, so there was no
Yeah.
sense in going in all the other stuff.
I do like the way you put that in, the year of the COVID, and COVID hijacked the nation.
Oh,
Yes.
that's what it was.
Very
Yeah.
nice, Kel.
Yeah, Laura and I took a quick peek. It did a pretty good job.
Yeah.
I think it says it all.
Thank
Yep,
you.
I,
All right, so I'll revise that, and then, is that something we sign? I don't remember.
Yeah, we usually do.
This last page is a signatures page, right?
Correct.
Okay. So I'll draft that and drop it off, and then Bruce, I'll somehow get it to you. The office is closed, right? So I'll somehow.
Yeah, either that, just let me know. I can pick it up
Okay.
on the end.
Okay.
Go right by house every day. Sometimes twice.
All right.
Not to interrupt, but I didn't know if you guys seen Beth had sent another text about the payroll.
let's see. So Beth was asking if our previous.
Accounts payable.
Okay,
It was paid through accounts payable.
Yeah, see, Robbie and Esther are both employees to payroll.
Yeah, we still need a contract though.
yeah, I mean, even Dennis said that they attached something so that everyone knows what their job description is.
Right. Right.
All right, so that's it for that.
Yep.
So we're gonna discuss tobacco regs and changes to CBD products.
Yes.
Can you guys hear me okay?
Yeah.
Yes.
Okay, perfect. I had my microphone set up, so I wanted to make sure. So I know I sent over just the documentation that I received earlier last week, so you guys have a chance to see it. The state did release new information on CBD and hemp products. MDAR is the basically people in charge of the product as a whole, but they are not regulating the retail sector of it. So they are leaving that up to the responsibility of the boards of health.
Okay.
They have outlined what are okay and not okay for products to be sold according to them. So I did not know if that was something that the board wanted to review and maybe adopt in the future, not necessarily a today thing. It just happened to coincide with, I know we were talking about limiting the number of stores that could sell some of the adult age restricted products such as glassware and paraphernalia. And then I know that CBD and hemp was one of the other things we had talked about as well. So I just wanted to include everything.
Definitely think it's something that we should look at.
I do also know that I had spoken to Roberta from the Smoking News, and I believe she is on the meeting. She had a couple concerns regarding the CBD and hemp products. So if she wanted to chime in.
Yep, there we go.
Hi, everybody. I don't know if you can hear me all.
Yep, we can
Yep.
hear you.
Hi, I'm Roberta. I own the Smoking News in Bellingham. And we've been there for about a year now, and we've been doing well considering the product list that we started with has been shrinking over time, but we've adapted, and the CBD products have really been doing well for us. We also have a store in New Hampshire where we sell CBD products. We're extremely responsible about how they're sold, and we do a lot of research before we offer them and so forth and so on. So, I think we're extremely responsible about how they're sold, and we don't see how they can adversely have any effects on people at all. We don't make claims that they have any true health benefits, but when people utilize these type of products, they have a lot of positive feedback to us. So we feel that they're helpful, especially these days in the world of stress and COVID and so forth. We've been told by a lot of people in the community that the products we've been offering are great and quite a diverse line of products. But we'd like to stay in Bellingham, but if, you know, all of these restrictions and things are eliminated from the things we're able to offer the public, then it's going to be difficult. I mean, it's really difficult as it is for a small business to survive these days, but we've been welcomed in Bellingham and we really like it here. We want to stay, but we have a lot of concerns about how a lot of the products we're offering are being potentially controlled by, you know, the state as well as the town. So we just really want to get a handle on it before we invest a lot more into what we're trying to do there.
So Rob, is this one of the stores you were thinking of trying to say that those that are in place now that are selling this would be sort of grandfathered in, make that number, let's say 3, 5, whatever it is, and then nobody else would be able to sell this stuff, or did I misinterpret what you said earlier? So,
Yeah, so we've kicked around a lot of ideas. I didn't know what the board ultimately wanted to decide on. I know at one point we had talked about combining the glassware and CBD as one age-restricted product permit. I didn't know if we were still going with that or if we were going to make them separate permits. But I did go through our list of current retailers, and just based on violation history, I was able to kind of sort through that list and see either who has been responsibly selling the products that they can versus have not been able to in the past. And out of our 28 current permit holders, that list shrunk down to 10. Either they had multiple violations, excuse me, or in the case of one of them, they were within 500 feet of a school, which I know is one of the regulations we have in the tobacco thing, but that particular business was grandfathered for their tobacco license. I wasn't sure, I mean, their tobacco permits. I wasn't sure if that same business would also be grandfathered for any additional permits. Just so you guys know, I don't know if you had a chance to review the document I sent over to you. The biggest problem that we're running into with what the state sent out for these products is that they're not allowing it to be put into food. They're limiting that only to the dispensaries right now. They're also not allowing the raw flower to be sold unless it's from a grower to a processor,
right.
or again at a dispensary. And you can't put it in animal feed at this point, according to them. And they're not allowing any products that make medicinal or therapeutic claims unless they're approved by the FDA, which I know the FDA is behind on approvals. So it's unfortunately kind of a perfect storm where that basically eliminates 90 to 95% of the products that are currently out there unless they rebrand or something to that effect.
Is
So
it true though that it's up to the individual towns to regulate, you know, that part of it?
The way that the state has left it is that the Department of Agriculture is the one that oversees the whole program, but they are leaving it up to the Board of Health to figure out how to enforce it. They gave a list of either permitting and age restricting products. They basically laid out how to do it, but they're just not doing it themselves. They didn't.
Right, I mean, I think they did that in a similar fashion in New Hampshire where my other store is. The state had some basic guidelines. They didn't really have any means of or really want to enforce. It kind of trickled down because federally there's nothing real clear yet because science hasn't really been done enough. And you know, studies haven't really been done federally to show the benefits yet. So I think the state put in some regulations that they thought might work, but they were leaving it up to the towns as to whether they should be instituted. And I think in all fairness, the town should be cautious about how they, you know, proceed with that because I'm not sure the state has really done a ton of homework as to what the benefits or non-benefits or any of that truthfully is. It's cutting out a lot of business for a lot of small businesses. It's gonna hurt a lot of small businesses.
Yeah, excuse me, Rob, and let me say this, Roberta. I don't know if you have a copy of this thing. 4 of the 5 here, basically, like prohibiting vending machines, self-service, and prohibiting edible products. It depends whether or not the edible product containing hemp or CBD could be put under an age-restricted permit or product restriction. If we do that, our permit now for tobacco is 21. So
Yeah, we don't sell any CBD to anyone under 21 anyway.
okay, so that takes care of that part. The other 2, as far as a vending machine or a self-service, we're never going to allow that.
Yeah, that's.
So if we age restrict it and we require a local permit, in other words, if you don't already have if you're already a tobacco vendor, you have a tobacco permit, we could add this as a, what do we call it, addendum to the permit. And then we're already age restricting everything by state law to 21. So, you know, it's pretty much alcohol, tobacco, CBD, hemp, everything's gonna be 21. And if everybody follows that rule, it's pretty easy. It doesn't give the Board of Health too much enforcement, except that we do what we call, you know, send a person that's not 21, that's 20 or 19. And we do things just to make sure that people are following the rules for tobacco and anything else. And we keep having a lot of people not doing it, whatever. That's a separate issue. So I think, Rob, we could look at A and B and, you know, as a board discuss this and say, well, we'll issue we'll just have a license if they don't have one. And then we'll make that local permit for a CBD/hemp product distribution and instead of tobacco. I mean, now if they already have a tobacco permit, we'll just addendum that to them. And then maybe we don't have to, let's say, I don't know, limit the number of businesses, because what it'll probably say is it'll be like our tattoo and our other stuff. We limit it to 5 or to 3, and next thing you know, people are approaching us for a variance to the permit. So number, let's say. So I don't know.
Isn't the age restriction already in place? I'm confused by that.
It
The
is.
age restriction is already in place,
Right, it is
but
already in
there is
place.
no one actually enforcing it. There's no one out there actually checking it.
Okay. That's what I'm saying. We add it to our tobacco age enforcement, our alcohol age enforcement. In this case, alcohol is not by the Board of Health, but these other things are by the Board of Health. So that would be our authority and our regulation is to, you know, have a permit. We obviously have a system if we have a permit for fines or suspensions. And then, like I said, age restricted is already done by the state for everything.
Right. So just enforce that.
Right.
I mean-
And the other objects, I guess it says prohibit edible products. We could maybe say that those edibles would go under an age restricted local permit. So, because, you know, if you look at it the other way, the Cannabis Control Commission and a dispensary, you know, is distributing, let's say, cannabis with THC through a dispensary. I don't want to see dispensaries in Bellingham, but this CBD only has 0.03%. And I guess if it's in an edible product versus some other way using an oil, you know, that you take in orally or on your skin, I'd probably say we could push that item as prohibited and just push it into an age restricted product by the local permittee. And as long as that doesn't violate the MDR rule, which it may, right? Is that right, Rob?
MDR is stating that those items are not approved for sale.
Okay,
So the items in 5B they are stating is not approved for sale.
okay, okay,
More or less that subsection 2 that we're running into a lot of problems with.
okay,
Because
okay.
most of realistically, and Roberta, you can confirm this, most of the products are on the shelves will say that, for example, like freeze contains CBD, and then it's, you know, for sore muscles and joints or something to that
Yeah,
effect,
yeah,
which
yeah.
then falls into the therapeutic or medicinal claims.
Right, and that has to be FDA approved,
That
which
would
is
have to be
probably
FDA.
not gonna happen for a while. Yeah, yeah.
I
I
didn't
mean,
know
I
if
don't
you,
think the state's enforcing any of what's on that sheet whatsoever. They're leaving it up to the individual towns to regulate if they want to. I mean, I can't imagine that any of the products in any there have any negative effect. I don't know why any of them would be restricted.
I do know that way back when we first started seeing CBD in Bellingham, maybe a couple of years ago, there were edibles, because when I went to do a few inspections, my only problem was the edibles were within reach, you know, of children, and they weren't glassed in. I'm going, you really, first of all, there shouldn't have been children there, but an
Right.
adult would come in with their kids, and a kid sees a piece of chocolate, and it's, you know, even if it has CBD and they can't get high. The point was, is it was not allowed. And I just said, you need to restrict the age to 21. In those days, it was 18, but now you need to restrict it to 21. And then I guess we can get confirmation from Cheryl Sabara whether or not the MDR would think we're irresponsible if we say we'll allow an edible product with CBD as long as they're permitted and that they're following the age restriction.
Well, Roberta, you said that you don't sell to under that age anyway, so that really wouldn't
We
affect.
don't.
Okay.
No,
Right.
we definitely don't. All our products are behind glass, all the CBD products. Really, the only edible products that we sell are gummies because some people can't swallow capsules or they don't
Okay.
want to take a tincture. So we have some gummies. They're in sealed packages, locked in cases.
Okay.
You know, we know they all come with data, you know, that shows they all have to be tested. We don't buy CBD just from whoever. All our CBD comes with testing data. That's actual tests have been done on that prove that they're safe and within legal limits. And some have 0 THC, some have very minuscule amounts within legal limits. And we have all the tests for them.
So I
Yeah,
guess
it says
Rob,
any food product containing CBD. Wouldn't that be a gummy?
it would, that's what I'm saying, yeah. But she's saying right now, no one's enforcing it. So Rob, let's do this. Let's contact
Well,
Cheryl
this-
Sabara.
yeah.
She's our lawyer and our Massachusetts Area Board of Health Director. Why don't we ask her
the
to see
letter
if,
you have is actually from Cheryl.
yes, I know that. What I'm asking now is if we stuck the prohibited edible products from either B2 or from 7C or E rather, and said we would allow it with the age restriction and with the permit. You know, it was 21 and with a permit.
Right, I think that.
I wanted her opinion as to whether or not she thinks that's being irresponsible as a Board of Health. And violate, you know, in other words, we can't be less strict than another agencies, but they're not enforcement. They're manufacture, distribution, and growing. So the MDR it's an agricultural group. I'm very familiar with them, but they're not stepping into the enforcement. They're leaving that to the boards of health because this is not an area that the Cannabis Control Commission is going to get into. You know, so because it's not a dispensary item, doesn't have THC. So I don't know. I think if we can get her opinion to whether we should do this from a legal and from an ethical point of view for Board of Health, I'd really
Isn't it
value
also
that opinion.
something that if we do a permit, we can also have a review of what they're selling before we issue a permit to see what they're selling exactly, and that will put us at ease as to what exactly the
Yes,
package looks
I-
like. If it
I-
says that it's for medicinal purposes, how much THC is actually in it.
Right.
We should be able
I
to see
have
what
all
they're
the
selling.
data. I have all the
Yeah.
data and
So if we
Robert's
have
been
that,
in and
then we can just do a new permit. Before they can do business, we want to see what they're selling. Anything new, we should have a review of it and just make sure it's okay.
Okay, but I think, like I said, let's get Cheryl's opinion as to whether or
Yeah,
not, you
we
know,
agree. That sounds good.
someone else is gonna come down on us and say like, hey, you know, you can't do that, you know. I never want to be in the situation where the Board of Health, which is a health group and does have policing powers, to, how they say, violate some other rule that's, you know, maybe not an enforcement agency, but a, you know, agricultural agency, which it's food, you know, so if you're ingesting it, they have a regulation on that food that's coming into the state of Massachusetts. So, you know, in some cases, a lot of what they regulate is use of pesticides, the use of, you know, things that end up getting into groundwater or into, you know, the environment and then affecting, you know, animals and offspring for years to come. So we've seen that from other pesticides with different plants, both vegetables and, you know, tobacco and stuff like that. So,
If I may, just while we're on the topic, Cheryl sent that letter because they are going to begin enforcing those. If you'd like, we can do the permit for now and just put a stay of execution until either another town does it or the state has more widespread ideas regarding enforcement, but those are the things they are going to be looking at. I
okay,
know that we also talked about potentially putting together CBD and glassware and limiting the number of those permits to either 10 or 20% of our total applicants, which would be either 3 or 6 permits throughout the town. I didn't know if that's still what we want to do. That's why I kind of went through the list of who we have currently for permit holders and basically created a eligible and ineligible list just based on violation history.
okay, yeah.
I also didn't know if we wanted to make it a requirement that they're currently selling those products for at least the original permitting side of it, or if that's something that we're just gonna, you know, first come, first serve on the permits.
Okay, but let's, you know, as Roberta just mentioned, you have the capsules or you have the tinctures, and then those are fine. They don't fall into an end. I guess, I don't know, it's an edible product, but whatever. But any food containing, so a gummy, is it food? I guess it is, because it's not, you know, the pure liquid, so, I don't know. So if we create this permit, do we just, and then Kelly brought up, do we have an inventory and say, well, we're not gonna look at that product? You know, if it's a violation of the rule, then technically we have to make sure that product's not being sold as that way. I don't know. I'm not sure. Okay, so what you said, Rob, that Cheryl put this together and the state is thinking of enforcing this, but they're looking to boards of health to do it ahead of them or
They are just
for
giving,
them?
they are giving it to the boards of health to do for them essentially.
Okay,
Because
okay,
I don't think it will fall under FDA until further down the road, similar to how FDA does their own version of tobacco.
correct, yeah. I think until it becomes national. Right
Yeah.
now, it's only the states, I believe, well, I'm not sure. It may be a limited number of states. It may be only those that approved cannabis and whatever it is, 19 or 20 out of 50. Whatever the number is. Maybe that's how it's not gotten to the FDA's burner, but they have a lot of other problems to deal with nowadays. So they won't be looking at this for at least another year or two. Okay,
Yeah, I mean, I think we still need to do some thinking and research on it. I think,
right, so,
you know, talk to Cheryl and, you know, I think we should definitely enforce the 21 and up. I think most people are doing that anyway.
right,
So I don't
right.
a huge difference.
Yeah.
Um,
So in other words, if we're doing the enforcement of the CBD places for 21, but if they don't have a permit because they don't have a smoking portion to it, then they don't have a permit. So we don't go to them because,
oh, I see. Yeah.
so we almost have to create the permit at this point so that we can say that you're selling these products to 21-year-olds. Beyond that, if they don't sell to a 21-year-old, we'll worry about the other categories, I guess, mainly food or medicinal claims at a later date when we get more information from Cheryl, or when we decide we're gonna do it on July 1st, 21, something like that, you know? I don't know. But we at least need to create a permit now so we can inspect the places for age. If we do that, we're at least, how do I say it, following local enforcement strategy 7A, which is requiring a local permit. And then B would be age restricted products. We'll just put them all age restricted right now. So
Okay.
I think we do that, we get A and B done. And then Rob can go in and inspect when he does the other shops tobacco, and we'll go with that. And then I think later, if you're looking for a number like 10%, 3 or 6, we can also use what Rob suggested is if you're continually violating, you're not going to be one of those groups. You know, you're not going to be one of that member of that group because, you know.
Well, I mean, if you sell cigarettes to a kid, you
Right,
know,
we're not going to allow you to sell
older.
these other products automatically because we just say, you know, you already have a problem with one thing. We're not going to be investigating 2 and 3 and 4 things, you know.
The other thing I know that we had mentioned at one of the past meetings was potentially requiring the built-in card reader for anyone that obtains that permit so that the transaction can't go through unless they scan an ID that's over 21. I didn't
Right.
know if that's something we still wanted to throw in there.
I think that's a great idea for have. It saves them money in the long run, and it is a tax write-off.
Right, right.
So just so I know how to approach this going forward, like I say, I have been reaching out to businesses to try to get either input or give them a heads up that something might be coming down the line. Are we going to be limiting the number of permits for right now, or is anyone who applies just getting a permit and then if they basically have a violation, it gets taken away?
That's a good question.
We have to build the permit first, right?
Correct.
And then
We
we can
do.
discuss that while we're doing that. Because I'm not sure about that right now.
Well, if we put the permit together, Rob, right off the top of your head right now, if you can do it, how many do we have that would apply for this? Or is everybody with a tobacco permit going to apply for this permit and automatically sell the other items? I don't know.
The problem is that there is no technical permit for now or for these products right now. So basically anyone can sell them.
Okay, okay.
They are kind of everywhere. I can think of about 20 places that have them to some extent, whether it be, you know, the gummies on the counter or things of that nature. I see them usually when I'm doing my tobacco inspection just because they're a lot.
Okay.
I'm pretty sure you can find them everywhere. Even TJ Maxx sells a lot of CBD products.
Yeah.
Okay. So I guess that said, Rob, I don't know if we're going to be able to limit the number of permits because once we produce this permit, which we should do as soon as possible, maybe you can write that up and then it'll be part of our age restriction. I guess we're just going to have to let them apply and we'll go with it that way there. No one objects to competition. I'm just thinking if we have 28 permits and already 20 of them are selling it, they're going to just apply for the permit and that's it. I don't know. I guess.
Yeah, I think that's a good idea, Vinny. And then if, we see that there's that they're selling to underage kids or
then we can
not following
suspend that
the-
permit. Right.
Yeah, we can handle it like we do with the tobacco stuff right now.
So
Okay.
am I grandfathered in, or do we actually have to reapply, or what?
I think you'd have to get a permit. Yeah. Because right now, even though you technically grandfathered in, we're not inspecting your facility for anything. So,
She
and
does
it
have
wouldn't
her
be like a
tobacco.
tobacco permit, which is limited to 30, and we only have 29, one left rather, whatever it is, or 2. This would be a new permit. For those that are selling tobacco and have this on the counter and want to sell it, they're going to have to apply for that permit as well. So that will be an added cost for them. But either that or we're going to make them give up selling that. And I'm not sure if we force people who are selling it now under disguises that, well, there's no permit, so I can sell it, then we're trying to limit it via saying, oh no, only the people with this permit can have it, and I'm thinking that's going to create correct me if I'm wrong, Kelly, like an adult only with a special thing.
Yeah.
And
we'll
since
go with the,
yeah, I don't want to think we want to cross that bridge. We did that once before and we got rid of adult only in this town. And everybody's 21 now, so they're all adults, but whatever, you know what I mean? I think we just do a separate permit for the CBD products. Those that have no permit will apply for that permit and get it. I mean, it's, you know. And then those that have a tobacco permit that realize now that they either remove that product or they have to apply for this permit can apply for it too. So I don't know. I mean, it's just open competition, but everybody will have a permit. And I guess in the case of tobacco, their permit maybe is more like an addendum, but they'll be inspected for age and for these products when we do our stings. And so, you know, I guess it's gonna be one inspection, not two, but it'll be basically the same thing, mainly age at this point.
Are
So
we going to base it off of any of the tobacco violations at all, or are we keeping them completely separate? Because out of the 27 permits we have, that list is really cut down to 9. The 10th is the CBD Relief Center because they haven't really had any enforcement visits.
okay. That's a good question. What do you think, Trish and Kel? I don't know. I mean, that's one way of getting it down to 10. So I don't know. And I don't know if that's fair. You know, it is what it is. I guess if you haven't been doing due diligence with tobacco, why would this be any different, you know?
well, if they want to sell it, then they gotta do it the right way, just like anything else.
Yeah, but what Rob is saying is you get the number 28 all the way down to 10 now. And these 10 apply and they go on the same system. If you violate, he gets suspended, you know, and fined, or vice versa. We can make the suspension longer in lieu of the fine, but that's what we've been doing in tobacco, just because the fines now for tobacco are state mandated and town mandated are extremely high. So we've been doubling the suspensions to, you know, try to eliminate the fine, you know. So I don't know.
I don't know if we want to pay people who are already selling it, though. That's the problem.
Right.
We only do 10 permits, then that's like what, 18 stores that can't sell it?
Well, no, he said there's 20, so it's 10 would get it, 10 wouldn't. I don't know. Somehow that just doesn't feel fair. I don't know if it's legal, but it doesn't seem fair.
No.
So maybe we you know, starting off, Rob, we do it this way here. From this point on, everybody who has it can sell it. They have to have a permit. That's the first thing. They don't get a permit, they cannot sell it. That's a violation if they do. And if they do, the only way of reducing that number will be through suspension. And I will assume the other 8 people that don't have it are not going to start selling it because there's already 20 people selling it in town. So
Right. Well, they could have already selling it anyway. They didn't need to have a permit. Or
maybe they're
permission.
selling other things like food, tobacco, and alcohol, and they don't need to sell CBD products. So that's it. So we'll assume that we're not sure what the other 8 stores are doing that have a tobacco permit, but let's just produce a permit and then offer it to the 20 places. You need to get your permit, and then Rob, you can inspect them, you know. So I don't know. Is this something you could think you can ask Cheryl if she has a permit format? If not, want to take a whack at it, we'll get the permit formed for the next meeting, and then we'll review it and modify it. And then I don't know if you feel like doing that, Rob. So
Yeah, I spent the last 3 weeks working on it, so I have a pretty open dialogue.
perfect. So why don't we have that for the next meeting, and then if we like what we see, we can pass it, and then we can make it effective 30 days later, and then these permits will go out, you know. So in other words, 30 days after we approve the regulation, they have to get a permit. So that gives them enough time to come down to, I don't know, electronically do it since we can't go into town hall.
One thing I do want to just raise as a point, in the event that they do, the state or other boards do start adopting the enforcement strategies and actually limiting the products that can be sold, what do we do for those permit holders? Because like I said earlier, 90 to 95% of the products that are currently being sold fall on that list of not able
Not to be
sell.
sold, yeah, I don't know, I guess they would be suspended. I don't know if we can grandfather that. That'd be like saying, I don't know. That's something.
Ben, can I chime in there, Ben?
Sure, go ahead.
So by the way, full disclosure, Roberta's my sister. So
Okay.
that's why I'm on the call. I'm not just checking in on old friends, Ben.
No, I was gonna say, how you doing there, Jason?
I'm doing pretty good. Look, if the state ever decided to take action, which I really don't see as foreseeable here, they're certainly not talking like that in all the other 20 odd towns that I represent.
Okay,
So then obviously that would take priority, and any local rule or regulation or policy that stands in contradiction to the state rule would be preempted. So
correct,
you could, even if it was still on the books, it would be preempted. So
correct.
you wouldn't
You can't be
worry.
less strict than the state or less strict than the federal.
That's
you
right.
know.
I don't see the state getting more strict on this is my
Okay,
my
okay.
on it. Certainly not on CBD. I see it being more liberalized probably, but who knows what will happen. Who
Yeah,
knows?
yeah. But as Robert brought up, some of these products technically are now on this list that Cheryl is our, director of boards of health and our attorney. She's a guest from this cast membership. She has said that basically that the towns are going to do it. Do we wait till another town? Or the state does it and says, we're gonna do it all boards of health will enforce this. I don't know. I mean, I think we just produce the permit. We allow this product to go as it is right now. Should the state come down and say, you can't do that, like you just said, it would be eliminated. You take it off the shelf, We had a lot of synthetics, right?
It's my understanding that they're going to federally, allow more CBD products onto
Okay.
the market
Okay.
as they study it more so.
Okay, so instead of more strict, it'll be less strict.
I think so.
Okay, okay. So in that case, it makes it easier for us. The latter would be is someone says, well, hey, you've been allowing this, you can't allow it anymore. We're gonna simply end that immediately as soon as we get a word from someone saying, you're violating the law, You try not to do those things, I don't like to be part of a group that's violating the law. It's not a good thing, So why don't we do that, Rob? Let's get a permit together. We'll basically enforce for having a permit and age restricting it. And then we'll leave the other stuff, which happens to be, most of the stuff that's out there. We'll just leave it alone, I guess, at this point,
I
I don't
agree.
know. What do you guys think about that? I don't know.
I agree with that, Vinny.
Yeah, because the other way, it just becomes like, geez, you gotta have someone throw product away. They'll say like, well, can you give me so many weeks to sell it? And I'm going like, I don't know. I'm gonna take this and say it's not the same as those synthetic drugs that they were selling, which certainly, unlike CBD, were getting people high, and they were selling them to certainly way under 18 in those days. But we got rid of that, and via the police department notifying us that there was being sold in certain places. So anyway, so I think we'll just leave this alone. And as Roberta just mentioned, it probably will get less strict instead of more strict, whatever. So, and we'll get 18
Health
permits
box.
for this product. So now the other thing too, is Rob, you might want to do this. There would still be a cost, but if you don't want to create a separate permit for each one of the tobacco stores to sign, I don't know if we can add an addendum to their permit, or just simply keep it simple. Everybody has a separate permit for this.
I would just keep it, Vinny.
Keep it simple. Yeah, okay.
If I can just add two things. If that is the case, then why don't we just remove the vaping ban? Because the whole reason we have the vaping ban is because they weren't FDA approved, which is the exact same thing that MDAR is saying, that these products are banned because they're not FDA approved.
Okay. Ooh. That's a good point. I don't know. Hmm. Well, wasn't part of the
Or
vaping
they
saying it is
had-
smoking
Haven't
in a
really
sense?
had any studies on CBD saying that people have health issues from taking it. Like vaping, they have studies that say that there are
Yeah, it-
complications with or vaping
right.
for a
It
long
is smoking in a
time.
sense, right, yeah. I think, Rob, it's different because it's vaping, whether it's water vapor, it's still hot gases. It's the product that they're putting into it, the nicotine and the other stuff, even if it's not nicotine, it's not regulated. It's coming from foreign sources. It's not FDA approved. I'm gonna hope that the MDA CBD products are coming from Massachusetts or distributors that are licensed to grow. If the state has a better environment to grow, let's say it's coming from South Carolina, but it's not coming from China. That's another thing. We might be able to say, we're not gonna allow any non-US CBD products to be sold in Bellingham stores. We could do that. So we get rid of any, what we call, not sure what the product contains, whether it's.
Roberta, where are these products coming from? Do you have an idea?
I specifically handpick my products. They come from Vermont, they come from New Hampshire, Massachusetts, and a few
Okay.
others. They're all certified. I know where every single product comes
Okay.
But they're not
from.
from
From China.
country.
Okay, because vaping products were coming from companies that moved their operations to China or to other.
That's changed immensely very recently. Every vaping product has to be certified. It's not
Okay.
the same as it was.
Okay, well, I think, just to call it, Rob, you know what it is, I think I'll call vaping a fashion of smoking. It does do damage to the lungs. So far, I don't know, does anybody smoke the CBD?
It is
Some
able to be
people do.
vaped, but that is,
Okay, well, we're not gonna allow vaping of it, so I guess they can't sell a vaping product that's got CBD, because we don't allow vaping products to be sold in this town. Right?
that is true.
Okay, so that rule will not change. Vaping is still banned, but as far as the other one that I know where you're going with, it says CBD products that are not FDA approved or, you know, whatever. I don't know. We're not going to get that in the near future. And I'm not going to say a CBD product right now is the same as smoking or vaping. From a medical standpoint, from a respiratory standpoint, it's like water and oil. It's not even close, you know?
Right, I agree.
Yeah,
So
it's not.
Roberta,
So,
your CBD products, they're the ones that you buy are pretty much in the US anyway. Out of all the places you just listed, you don't buy from outside the country.
Absolutely not. I try to actually get as many smaller local companies as I can.
okay.
And then I have a few others that are national, but I handpick all mine and everything comes from around here.
Okay, keep
It's all
small business going, right?
That's all certified. I have paperwork for every product I sell. I can't speak for other stores in town. I can honestly say that I go over and above
Mm.
with the CBD I sell to make sure it's all.
So Rob, do you want to maybe get a, you could do this. We can throw a permit out there, and as Roberta just mentioned, we might be able to look and see if someone's selling a CBD product that's not US born and is not certified. At that point, I think you're taking a chance. It's like getting a food substance that has no list of ingredients. You don't have any idea if there's pesticide in it. You have any idea if there's any animal or plant byproducts that are not even real, like all filler material, 99% natural. Yeah, well, it could be something you can't even digest, So maybe we can add a thing there saying there has to be some kind of, what would you call it? A certification that the product is safe, it's locally grown. Or,
All the companies have those certifications.
Yep.
All legit companies have them.
Okay. I would think if they didn't, they'd get in trouble with.
No, they have to. They have to.
Okay, fine.
Well, that's good to know. See,
Yeah.
we're CBD.
Yeah, I can help you with anything you need to know.
Roberta's
Rob-
actually been a great resource for these things. I know I've
And I'm happy to work with Robert and any of you.
Okay.
If you
So
want
Rob,
to-
once you do that up, get that together, and like I said, well, and you can make sure too, that we're not actually, there'll be, I would say no vaping, CBD products, I don't know if that's gonna hurt the business, but it's just like well, I mean, we shouldn't be selling, we don't allow vaping products to be sold in Bellingham, so if it's CBD that can be vaped, I guess that one piece has to go away because it would violate our tobacco vaping, regulations. So everything else, like let the edibles, let the semi-medicinal stuff, we'll just let that go until somebody from FDA or somebody else steps in and says, like the state says, oh, you can't do that, because maybe everybody will choose the easier way out, like we're going to do. I don't know if it's easy, but it's less work if we don't have to eliminate 9/10 of the things on the product list.
Right, well, that's what we do anyway. We're not trying to shut businesses down or
No,
try
no.
to stop people being able to sell things that they think help make, their business run. So, and, comparing it with vaping, I don't think we can do that
No.
at this point.
So let's just have Rob, why don't you put that together for the next meeting and we'll get something out, maybe by March 30th or March 1st or March 15th. We can do it 30 days after. So whatever the meeting date is that we adopt it, we'll make the permits effective. We'll get Laura to mail them out and we'll do it that way there. That way we can use the mail. We don't have to have people contact, and then they can do payment like they're paying for a bill, something like that. And then I would say you can choose a time 30, 60, 90 days after the permits are out to put them into your inspection routine, and let's see how it goes. Hopefully it's better than tobacco.
Sounds good.
Okay.
And then are we going to have a separate permit for glassware as we had discussed, or is that going by the wayside?
I don't know. What do you want to do with that, Trish? Kelly? I don't know.
Would that not fall underneath the CBD? We couldn't do that. CBD has to be its own permit, or?
Depending on if you were doing an age-restricted product permit, then you could loop them together more than likely.
Oh,
If you were
okay.
going to separate them out, then you would have to have two separate permits.
Mhm.
And the original reason we were doing the permit was to limit the businesses that are continual offenders from selling more products, because that then falls under, in the case of, a sale of a glassware to a minor, that then becomes criminal because it's considered paraphernalia and the police get involved. So
Right,
it's one of those things.
Well, maybe make that a separate permit. I don't know. What do you think?
How many of them have the glassware?
I would have to say probably somewhere in the ballpark of a dozen.
Wow, I didn't realize there was that many.
But if you lump it with the age restricted, you're kind of going in checking for two things at the same time.
So are we just going to require businesses that are selling glassware or CBD just to have a card reader so that we don't run into compliance issues? I don't care what we do. I just want to make sure that we don't keep having sales to minors.
Right.
Yes, so definitely want everyone to have a card reader, and I think that we should have that by a certain date.
Yep.
Whether it be, the end of the year or July or something. But I think we should definitely put a date, and everyone should have a card reader, because I agree with you. There's lots of offenders with, people just either not looking at IDs or typing in fake birthday.
Yeah. Trish, I would not, good. I wouldn't want to wait till 22, because let's use the state fiscal year, July 1. And even then that's stretching it, because in the meantime, those places that continue to sell, we're getting them before us with hefty fines and suspensions. And I'm going, we can solve this if they put the money into a tax deductible item that'll prevent this from happening, it'll be like it's less than one fine or it's equal to one fine. And I don't know if you want to keep stretching the date, we keep getting more non-compliance issues.
That is
Even,
true.
you know, and I'm going like,
How many people actually don't have the card readers though? Because I know some of them do, but
Most. We probably have 5 that have card readers now,
yeah,
and
yeah,
well, 6 that I know of.
Yeah.
But 3 of them were just added because of violations.
yeah.
right.
And Trish, you know, Robert will tell us this. One of the places is the person that, or the place that's already had 4 violations. This guy who sold was the same employee who sold last time to Rob. And they don't have their machine in yet because the guy hasn't put it in yet. I guess the manufacturer has not installed it yet. So, you know, so I don't know. I think the longer we wait, the more costly it gets and the more regulatory we have to become. You just can't have a law and say, well, we're not going to fine you even if we catch you. You know, what good is that? You know,
Right.
I mean,
So what do you think, Bobby? July 1st, or is that
I
too
even
much?
think that's kind of late, but whatever. I don't know.
Well,
June?
July, just because it has been taking people a while to be able to either find a system that works for them or to have someone come out and install it, and with not knowing what COVID is going to bring in, you know, the next few weeks or months, it's probably not a bad idea.
All right. So we'll push for the mandatory card readers for July 1st.
This way it also gives them time, Vinny, to.
Yeah,
save
that's
up
good.
or-
No, I'm not saying no. I'm just saying, I didn't want to put it till January 22. July 1st was what my first suggestion was because we're closer to July than we are January. And, you know, like I said, I hate to say it, these people keep selling to minors consistently. It's not even, you know, it's like, I don't know.
I have to just comment one thing. I've been in business for over 20 years. I have another store in New Hampshire, and I have never once had an infraction. And I promise you that's the truth.
Yeah.
So, I mean, I can understand making people buy these pieces of equipment if they have infractions. I card everybody, and I always have, and I don't have a problem with buying the machine. I'm just saying, it's not that hard to do. So I can't believe so many of these stores have them. That's all.
Well, trust us. We say the same thing. We're like, we don't understand
Right.
how this happened. You know, it's one person not asking for an ID could cost you $2,000 in a fine. So why take that chance? Seems like a lot of money for something so.
I'd never take a chance, never.
And-
My staff never does. We
Right.
never, it's silly.
One store, this is their 4th time, and the last inspection, which was, I'm gonna say probably October or November. It's the same employee who just did it a week ago.
That's ridiculous.
And
That store that Vinny is referencing is the one that did not have a state license.
yes, yeah, I know that, but that's a separate issue. I'm just saying, as far as this selling to someone under 21 or selling to someone under 18, they've been consistently doing it now. And, you know, and we waived the fines in lieu of an added suspension. We waived the last fine to get a card reader, and it didn't get installed since, well, again, it was Christmas, it was Thanksgiving, it was New Year's, maybe, and it's COVID. That's a good reason why the manufacturer couldn't get out there. But, you know, you got to feel for the person who's saying, like, if you know you don't have it, and you know you have an employee that's like, or a relative that just doesn't get it, I'm going like, you know, it's like slap us in the face, you know, we're I don't know. We just have to keep saying, what do we got to do? You know, I mean, whatever. I mean, we have permits and we have rules. Majority of people follow them. If they have one little mistake, fine. They have 3 years to, you know, 2 years to get rid of it, you know, but when you have 4 violations in less than 2 or 3 years, and some were
Well, then they really
like, you know. Yep, Corona may have done that, but I don't know, 1 or 2 of them were before Corona though. It was like,
But like Tricia just said, these ones ruin it for the ones that are doing it correctly.
correct, yeah. I mean, we could make it for, you know, in the case of Roberta's, if you have a violation, you have to buy one. We could do that, but I don't know. Is that being playing favoritism? Is that saying, well, the rules are different for you than somebody else? I don't know. I don't know.
No, we're trying to keep everything just simple and across the board.
Correct. So let's say, Rob, write up the permit. We're gonna put glassware with it or not? Separate permit?
Or are we just going to allow glassware to be sold with any tobacco permit, the way that it currently is? I know that was one of the concerns of the board, was that too many places were selling it that were having violations, or that it was easily accessible.
Yeah. Well, if they sell it to under 21, then it's considered more of as a board of health and a police violation, because paraphernalia. I don't know.
How did the police get involved with that though? Because we've already had like one case with that.
They were involved in that one.
Yeah.
Yeah.
They ended up pushing it back towards us because they didn't want to write a criminal charge on it,
Right.
but it is technically a criminal charge.
They let us use it as a misdemeanor, just a hefty fine, and for selling under 21, not glassware. It was listed as a tobacco violation fine. So,
Yeah, it was more like a double jeopardy situation where
Right.
we were already.
So I think we just create the separate permit. It'll make it easier. We treat it as a age-restricted product violation instead of a criminal thing, because every time we get it the other way, we'd have to turn it over to the police department for criminal action,
If the police don't want to deal with it, then
No, I can hear them right now saying, what are you guys, don't give us any more work than we have enough, and they do, they have enough. So I think we do a separate permit. It's age restricted. And those people, because if you add it to the tobacco one, then does that cover it too or not?
The glassware is currently covered under the tobacco permit.
Okay. But if it's sold to someone under 21, it's a criminal act.
It falls under both categories, yes.
Yeah, so
no matter
let's make a separate permit. That way it won't, right? Or will it?
It's just up to how you guys want to enforce it. In the original case that it happened, it was kind of the first time it had happened. So
Okay.
we worked jointly on it. But if it's something that you definitely want to take over, then we can just be the regulating authority on it.
Question
Okay.
for you. What do these glassware products run? How much are they? They're pretty pricey, aren't they?
They vary. There's some that are $10. There's some that are
Oh.
$50. There's some that are $150.
Thousands,
Yeah. So
All right.
I don't know. I think we do a separate permit. We keep it non-criminal, I guess. I don't know. I mean, it's a little more work, but it's, I don't know. And they would have to,
Rob, what's your thoughts on this? Because I mean, to make it where it becomes a criminal offense and nothing gets done, it's kind of pointless to enforce it that way. Do you agree? Or-
yeah, I mean, my goal in the end is compliance, not citations. I mean, we've
Of
written
course.
what, $50,000-$60,000 in fines, or that we've then washed away as, extra suspensions in the past 6 months, even basically since I took over the position. So when it's the same place that's having 2, 3, and 4 sales, I mean, most of the people that I took off the list today have had 2 or 3 violations just since I've been in the position. So I don't think that they should be able to sell the products, in my personal opinion. I think that once you've basically, you can only cry wolf so many times. You can only tell me that
Right.
you're going to card so many times. So if I
Yeah.
don't personally think they should sell them, if they want to put it in a card reader and tell me that it's not going to happen again, I am happy to take them away the first time it does. I don't care how it happens.
Right.
But I wanted to have some type of idea of how to kind of get a handle on it, because I know the original thing you guys had all said was that you didn't want stores popping up all over the place that we can't really regulate, or that are continuing to be bad players with their permits, because now we have more permits that are available, as well as also on the CBD side of things. There was no regulations for instance, the CBD relief store on the south end of town. Fantastic business. I've done had a lot of conversations with Jocelyn over there, that's the owner, but that was one of those things that just kind of came up in a gray area, and there was no permit for it or any way to regulate it. So It's just more or less trying to get ahead of anything else that might.
Well, we will have that now, so that'll, everybody, those groups will fall into it. So I guess Trish and Kelly, think about this. What Rob is saying is, I don't know, how many stores you said they're up to like their third or fourth or whatever. You'd like to not offer them a glass permit, they have to remove the glassware. And I guess we could do that based on, or we could just say from this point going forward, you sell that product one more time to someone under, you have to get a card reader or you lose your permit permanently or indefinitely. You know, I don't know which way seems to be like,
So if we do two separate permits, then
we
why
can,
we would do the two separate, Robbie?
Yeah, we could definitely do 2 separate permits.
yeah, that way there we start off with a clean slate and we'll just say, you know, and then if we do the 2 separate permits, we'll still mandatory a card reader by July 1?
Yeah, I
And-
think we should
okay,
still do
and that way
that.
there shouldn't be any more violations with age. So it should be real easy for Rob going forward after July 1. And
Hopefully.
the only thing will be like no license.
Poor Robbie, he does
I don't know.
with thinking give people benefit of the doubt and then they sell to another underage kid or they don't do their part. I mean, this keeps happening again.
Well, yeah, but then we'd suspend it at that point. You know, at this point, after July 1, they'll have a card reader. They shouldn't, you know, unless they put their own ID in, it should never happen again. You know, we've had that. So let's assume that that's not going to happen, you know. You know, we'll tell people you gotta use your brain, you know.
Okay, so we're gonna start looking at permits for the glassware and the CBD. So that's onto the agenda for the next time.
Yep.
All
And
right,
Rob,
so we'll
if you
look
can
at-
do that, that would be great. And we'll have at it on the next meeting. So
Yeah, I'll have everything put together.
And then the card reader will be as July 1st.
Yep.
Yep.
Thoughts on this, Robbie?
Yeah, whatever you guys want to do is fine with me.
Okay. All right, anything else on this at this time?
Nope.
All right, so we'll go to the simple part. We're gonna go to employee calendar for January. What's this, Jan? Did we already see that? I thought it said when I was back.
I think
Oh
we
no,
did this December, right?
We got a day where both Bruce and Laura are on vacation.
I saw that in February.
Oh, really? So
And-
which one of you wants to cover the off? Well, we can get the other lady that does the extra hours. She can do the office desk and I'll cover for Bruce.
Are you able to cover Bruce the 2 weeks that he's away?
Oh, was it 2 weeks? Well, I did Christmas and only one time I had to go out for a septic inspection. It was beautiful and no complaints. Can you believe it? Everybody was hunkered down or they left the state of Massachusetts or Bellingham. So it was great. So I'm gonna assume that everybody's gonna go away for Valentine's Day for that whole week. They're gonna
Well,
go to
that's
Florida, Disney. I don't know. Is it
It's-
school vacation too? Yeah.
Yeah.
You were lucky, Vinny.
Yeah, I know. I was lucky. Okay, so I'm gonna call my luck. I'm lucky. Whatever.
Were we gonna try to do meetings once a month?
Yeah, that's what we had discussed. I mean, and looking at this agenda after waiting, you know, I mean, we had the holidays and stuff, but
We were
This
lucky though. I don't know. Let's do it this way here. Between now and the 2nd, let's see how it is. You know?
I'm not gonna be here for the second. I'm just letting you know.
Oh, okay.
No.
so should we change the date then? Because Bruce can't be here for the 16th and you're not going to be here for the 2nd.
Why don't we do the
Maybe
9th and then we'll decide whether we well, actually, the 9th, 2 weeks will put us, into the 23rd. I guess, it'll be easy if I do health agents report, if there's no complaints and no inspections.
So you want to do the meeting on the 9th?
Yeah, let's do 9th, yeah.
Okay. And skip the 16th.
And the 2nd, yeah. So-
Okay.
So Rob, we're gonna get those stuff for the 9th, and then, it'll be likely that we can vote on it on the first meeting in March, or we go with the 23rd. We could see that, let's see how busy the 16th is, because that's pushing it now literally a month. So
So
let's
the
see. if-
next meeting after that would be March 2?
Yeah, I guess that would be okay. And then we'll do our regulations, once we enact them, we'll make it April 1. Or April 2, whatever, if somebody really wants 30 days, We'll do April 1st, that way it's almost a month, and we'll have separate permits, and they have all the way from the 2nd of March to the 1st of April to send in their application filled out. We could probably produce that online too. If you can get, Rob, if you can get that to Laura, once we approve it, have her put it as an online application. They fill it out, send it in, and send us a check or whatever. And just like pay a bill. And then they get the permits. They'll have to probably they can mail them out. I think it'll get there in time. So. And then you can do inspection 30 or 60 days later, so they'll certainly have their permit. Anyway,
Okay, moving on.
so I'm covering for you, Bruce. Thank you.
What's that? I didn't take any vacation this year.
I know, it's fine, it's fine. I'm gonna think I'm lucky.
It's
I
the
should
beginning
get-
of the year.
I
We're
should get
only
a medal,
February.
a silver
year-
star.
None of us did.
Put it this way here, one of the days we're closed for President's Day. No one will be in the town hall, they can't call. Perfect. Then we got a couple of weekends, we're all set. I feel lucky.
I'll bring my tablet and you can zoom in and I'll say hi poolside.
You guys just have to remember, I said I felt lucky till I complain. No complaining.
So we're all set with the calendar here?
Yeah, we're good.
I just want to take a second. I know we had talked about giving Esther a raise, and I know it's been brought several times here, but you guys haven't voted to give her raise yet. I don't know if that's something.
We're gonna do the contract and do it all at the same time.
Okay. Well, we gotta
Oh,
do this
that's all right.
contract quickly. Because now she's
Well,
waiting until.
that's why I've been saying you're gonna get that review done in time then. Bruce's took a while.
Yeah, I know, but we have like, how do we call it? We're gonna use, if we use a similar format or something like that, whatever we got from.
Beth is sending us a new one.
Perfect. So we'll do that real quick and, we can get it
We'll
in.
retro it. It's not like we won't.
Yeah,
we'll
okay,
retro
let's do it that way. We'll retro it. That way there, the hours she worked between January 1 or January, what's today's date? 12. To the date we enacted, they'll just get retroactive, so whatever. Yeah, I like that, Trish, because, it's not fair if you lose them.
That's
another 2
reasonable.
months. Yeah. Okay,
Complaints. Let's move
Okay,
this
so
along.
we had a couple complaints. The 31 Belanger came through. Each of you text me. I had sent the woman a letter. She was cleaning out her basement in order to have some work done. So she put the material out there. The complaint came in by our trash collector, picker, the truck driver. By the time she got the written letter, a dumpster had been delivered to the property and it was picked up. So she wasn't even,
Perfect.
having the trash out there, but more than maybe 3 or 4 days.
Yeah.
So that's been all picked up. And then, of course, Larry's got picked up. I just want to point out to Vinny, I know I go through there and Kelly goes through it. If you see that, there's a number right on the bin call them. They will.
Okay, I'm gonna tell you
call me,
today,
And I'll call them.
But
but
keep
they
in mind,
do
Vinny, you're
respond.
also, it's also during a time when everybody purges. They get new stuff, they throw out the old stuff. And they, even Planet Aid, you know, they have time off and vacations too. So
I
you
know,
gotta give them some time
but
to pick it
today
up
it
during
was
this
out
time.
there,
So I'll call them again. It's
4 or
out.
5 bags, you know.
Okay.
Put it this way here. That guy, since he's getting money, needs to call Planet Aid instead of us doing it. He needs to look out his side window and call them because, you
How do
know,
we know that he doesn't do that then?
well, when I went in to visit him, I said, you know, and I said 4 o'clock on Sunday, you're getting fined. And I never went back. I went back Monday and it was cleaned up, but, the point
They
is,
do
he said he
respond
was
pretty good
calling
when-
them
when
and
we
they
call
weren't
them,
picking
though.
up the phone. Probably
They
because they were
do
on vacation.
respond well. I agree. They do respond well, and that's what makes me think that
Okay.
they don't call them, because if they called them, then we wouldn't have to call them. Just,
Right.
well,
So,
I don't call, I text the person and then they
okay,
somebody
but we
somebody
shouldn't
else.
have to do that. They're getting money for having those bins there. They need to police the bins. He could even go out there every night when he closes his shop, drag the stuff up and throw it in his dumpster. But he won't do that because it takes space in his dumpster.
You know what would be a really good idea is to put up a camera there.
I know. Okay.
You know, somebody was belly aching about getting a camera. I
I know.
forget who
Okay,
it
tell you
was,
what,
but somebody
Kelly,
was doing that.
tomorrow you hold a ladder for me.
Yeah, I've heard that one before.
No, I will call you in the
I'll hold the
morning.
ladder for you, Vinny.
Okay, Bruce, I'll call you in the morning and we'll head up there.
Well, you'll have to do it Friday.
Oh. Why was tomorrow?
Tomorrow I am with the
Oh,
clinic in Franklin all day.
that's okay. Fine. Kelly will help me. Right, Kel?
Oh, yeah. The best view in town. That's me at the bottom of the ladder.
Yeah. Maybe they'll get a picture of that, Vinny not falling all the way down the ladder. I get it. No,
Okay, let's move along. Various mass complaints. What's that one?
That's typical. It's an average day in the neighborhood. We get them all the time. We send out a letter. We go by and visit. Actually, Rob went by and took care of one of mine, and now the guy goes through the drive-through lane instead of at the counter without his mask at Dunkin' Donuts. You see something, you say something, and most of the time it works.
Okay. So is the employee, not the customer?
Can we put up Trump's wall across the Rhode Island Woonsocket border, and maybe most of that'll go away?
I know, seriously, that's a huge issue. Most of the people that come over to our town are people from Woonsocket that aren't wearing a,
Yeah, but they do have the same
seen 'em.
regulation in Rhode Island.
well, or Rhode Island, I would say. Can't say Woonsocket, but they're from Rhode Island because I see them get in their car after being in, walking out the store. They didn't have a mask on, get into their car and take off.
If somebody could get me the governor's email address in Rhode Island, I would send her an email every time.
She's gonna be leaving to be Commerce Secretary, so
I know.
whatever,
Maybe the new one will come in and be better enforcer.
we'll see. I think it'll be we call the attorney, the assistant governor, whatever they call him. Lieutenant governor. And they'll do a new election, probably in July. So where the mass complaints been? I haven't seen too many lately, so I thought that was
There
pretty
was one
good.
at Home Depot about some guy wearing his mask under his nose. I don't know if you saw that one.
Yeah.
I saw that one.
Yeah.
All right, so moving on to bills.
Bills, okay. Does that mean I'm on?
Yep.
Yeah, there's quite a few of them, so.
Yeah, okay, hold on. Let me get them out. Yeah, I'd like to make a motion. We pay the WB Mason bill $49.99 and
I think it's $23.86.
And then there's another one, Kel.
I think one was for building, one was for us. The 49 was
Oh.
Tim, I think.
oh, is that it? Okay.
There was
Oh,
one
yeah, it's
2386
building.
I got it.
24.
I don't know. Okay, I got it. Okay. Change the motion. I'd like to make a motion. We pay WB Mason office supplies $12.24.
Okay, I second that. All those in favor say aye.
Aye.
Opposed, motion carries.
Okay. Let me just sign that one. Okay. Let's see, betterment bills.
There's a Norfolk County Registry.
Oh, no, sorry. Okay, sorry. Yeah, Norfolk County Registry of Deeds. I'd like to make a motion. We pay Norfolk County Registry of Deeds 5 recordings for $530. 25 Main Ave, 39 Potter Road, 41 Roy Street, 1007 South Main Street, 346 Teresa Road.
I second that.
All those in favor say aye.
Aye.
Motion passes.
Okay. Okay, I'd like to make a motion to pay AF Bergeron Electric and William Goodman of 20 Bertine Street, $1,575.
Second that.
All those in favor say aye.
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 Opposed, motion carries.
Okay, I'd like to make a motion. We pay Phil's Landscape and Excavating and Dubois of 101 Westminster Street, $21,500 for betterment septic
I
system.
second that.
All those in favor say aye.
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 Opposed, motion carries.
Okay, I'd like to make a motion. We pay Cook's General Contracting and Dubois of 101 Westminster, $350.
I second that.
All those in favor say aye.
Aye.
Opposed, motion carries.
Okay, I'd like to make a motion. We pay Dave Brown and Marco Mendez, 9 Janet Avenue, $9,400. Septic repair.
I second that.
All those in favor say aye.
Aye.
Opposed, motion carries.
I'd like to make a motion. We pay. Oh, we already did that one.
No.
Nope,
Good
okay.
idea.
Phil's Landscaping and Excavating and Quinton Jones, 375 Center Street, $24,800.
I second that.
All those in favor say aye.
Aye.
Opposed, motion carries.
If I can butt in for 1 second, that Phil's Landscaping, Quentin Jones is 763 South Main Street.
Oh, 763, okay.
No, it's South Main, you said center.
Oh, Center, okay. So 763 Center.
It says
South-
center on the accounts
Main.
payable ledger thing, so that was,
Okay,
you did it right. It's just, it was written wrong, Vinny.
okay.
So it is for South Main.
So it's 763 South Main Street.
Yeah.
Okay,
I
correct.
second that.
All those in favor say aye.
Aye.
Opposed, motion carries.
Okay. I'd like to make a motion. We pay ADC Septic and Jennifer Carter at 41 Roy Street, $23,000 for septic repair.
I second that.
All those in favor say aye.
Aye.
Opposed, motion carries.
Okay. I'd like to make a motion. We pay Land Planning and Gerard Dubois, 101 Westminster Ave, $1,295 for engineering.
I second that.
All those in favor say aye.
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 Opposed, motion carries.
Okay. I'd like to make a motion. We pay Seth LaJoy and Quinton Jones, 763 South Main Street, $2,500 for septic plan.
I second that.
All those in favor say aye.
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 Opposed, motion carries.
Wow. We're finally done.
Good job.
Yeah.
Do we
Yeah.
have plans or no?
Two septic
You
plans.
have plans, yeah?
Two plans.
Okay. See if I can read this here. Okay, I'd like to request a local upgrade approval for 11 Highland Road. Request 310 CMR 15405 1B to allow septic tank to be installed 8 feet from foundation where 10 feet is required. 310 CMR 15405 1A to allow leaching field to be installed 7 feet from the property line where, is that property line 10 feet? I thought it was 20 feet, it says, where
Oh, it should be 10, I'm sorry, Vinnie, 10 feet.
Okay, yeah, we're 10 feet's required. Yeah, I knew that was 10.
Good catch.
Foundation is 20. Okay,
That's right.
I'll just redo that. Allow leaching field to be installed 7 feet from the property line where 10 is required. Then 310 CMR 15405 1B to allow more than 3 feet of cover over the leaching field.
Okay, I'll second that.
All those in favor say aye.
Aye.
Opposed, motion carried.
Give me 1 second to sign this and date it. Okay. Okay, I'd like to make a motion to approve the application disposal construction permit for 11 Stone Street. It's a local upgrade approval, 310 CMR 405 1H to allow the depth of the system to be 3 feet to groundwater where 4 is required. Soils with greater than a 2 per inch permeable. Perk rate per inch, right? So it's a waiver of groundwater from 4 to 3.
Okay, I'll second that.
All those in favor say aye.
Aye.
Opposed, motion carries.
Done.
Have we satisfied the agenda?
I think we have.
I'd like to make a motion to adjourn.
All right.
I'll second that.
You seconded that. All right, motion carries.
Aye.
Okay.
Very good. So I guess the next
Everybody.
one's the 9th, February 9th. I'll get this annual report for signatures out and then we'll somehow get those bills and plans to us.
Yeah, I'll try to drop these off to you tomorrow. Actually, Kelly, if you're gonna hold a ladder, and I did tell this guy we're gonna put it up there, so we're doing it. I'll pass the plans off. I'll pass the baton.
Well, how fast does Bruce need these, Bruce?
I know, I won't be around tomorrow because I'll be in Franklin, but if I could have them Thursday or Friday, I mean, let me know. I can swing by wherever they end up and I'll pick them up.
Okay.
Whoever's got them last, just let me know.
Well, if you get them, Kelly, then you could drop them to Trish, right? And then Bruce can pick them up at
Put them in the
Trish's.
mailbox and text me. Give me a reason to go down and check Stop and Shop for Mr. Sullivan.
Yeah, yeah.
It's been really good. I've been looking. It's probably
Hey,
one of the
Bruce,
better.
we only have 1 copy of Highland, but we have 4 copies of Stone Street.
I've been only asking for 1 copy. And if
Oh,
comes in looking for it, we've got the machine now. I'll make an extra copy. I'm trying to.
okay. So in other words, we're saving
Trying to save space in the files.
the planners from, the engineers from producing a ton of copies for you.
Yeah.
Okay,
Trying to do
Got
some.
it.
All right. Good night, everybody.
Right,
Good night.
everyone.